going through a Citrix application to access Cerner. It works great. We're going to CPOE, I think it's February 29th, although there's some rumors that may be pushed back a little bit. It works great. Orders in at bedside. You know, instead of running to the nurse's station or being congested and you know, trying to fight for a computer, they're sitting there at bedside, showing the patient their labs, their x-ray results, their CT scan results, at bedside. And most importantly, you know, they get a question about something, you know, they look it up on UpToDate or one of our other excellent resources from our library. I mean, it's unbelievable. I mean, here, I'll show you some of the things they're using. They actually use Procedures Console. We had a resident the other day, had only had minimal experience in doing paracentesis, but was there with their attending physician doing a procedure, and they wanted to do a paracentesis. So they just looked on UpToDate, and they just, you know, looked over, scrolled down. Well, here, I'll show you the thoracentesis. Paracentesis is there somewhere. But anyway, so they just scroll down. They can sit there and they can, you know, watch a whole video of how it's done at bedside, you know, from our library service at NSU. Sit there and it takes them through the whole thing. Right before they went through the see the patient, they're sitting there watching the whole thing in live time. Right before they do it with the patient. I mean, how cool is that? And it tells them how to do the notes. They can copy and paste this into their notes. I mean, it's unbelievable. I remember when I was a resident, you know, before I had to do a thoracentesis or paracentesis, I had that little book. I'm sitting there reading this out of this little book. You know, how much faith does that, you know, inspire in people when you're sitting there reading out a book, when you can actually watch a video of how to do it. I mean, see one, do one, teach one. I mean, that was like the old classic thing. You can literally see it right while you're doing it. I mean, it's fantastic. I mean, and this is one of the things they're using. They can actually access their schedule. We use this scheduling program, and if you haven't used it, it's called UpToDate. I'm sorry, it's called MION. But it's basically a scheduling application, and they can have it integrated in their calendar. They can tell it down to, you know, the very second where they're supposed to be scheduled. You know, I make schedules for a lot of residents every single year, and it just automatically gets pushed out to their mobile device, out to their to their calculator. You know, for medications, I mean, it's unbelievable. They can sit there, they have a patient that came in, they said, well, you know, I know a rectangle pill that's pink, but I don't know the name of it. And so they can just go over, you know, using a totally free application. They say, okay, it's rectangle, and it's pink. Okay, there's two of them found. They sit there and look at them, and they tell the patient, okay, does it look more like this one, or does it look more like this one? And they can just blow it up. And so actually, this was a true story. I had a patient, you know, recently, same situation, and they said, you know, I'm not quite sure. And I said, well, you hear voices if you stop taking medication. and they said yes. And it was the Abilify, obviously. So, but yeah, Hippocrates. Yeah, that was from Hippocrates. So yeah, totally free app. You know, we have languages that come in all the time, and obviously we teach and train our students and residents about how to appropriately use language lines and interpreters and stuff like that. Every once in a while, you got to go in and you got to ask a simple question, and the interpreter's not there, or your Spanish may be rusty on a word or two, or you know, you got a patient that speaks some other language. You know, this is called Google Translate, a completely free application that every one of our residents has now. You know, say for instance you have a patient who speaks Arabic, and so you just click on the Arabic translation. And say, for instance, you left the room after the translator left, and you had a question, and okay. Yeah, so totally free, and it's called Google Translate. If you guys don't have it, you should download it. It's awesome. And so you can say, do you have chest pain? And not only does it spell it out in Arabic, right? But you can also so, you know, if you have a language impaired patient or a visual impaired patient, you can blow it up pretty big. So here it is in live Arabic. So anyway, it's just amazing how the residents are figuring out how to use this technology on a daily basis. So here are some of our experiences. First of all, our morale went through the roof. this time of the year for a residency program, it's like the bottom. This is where the residency trainees get burnt out in medical education. It's awesome right now. They couldn't be more excited. We had a record year of program applicants to the program. Because applicants, young, brand savvy folks say, hey, your program has it. You guys have iPads for every trainee. You got it. And so they love it. We have these electronic health records and the library resources everywhere. At bedside, taking care of patients. I mean, how cool is that? And unbelievable research opportunities. I mean, our team has all sorts of ideas. They're going to go forward with how they're integrating all these technologies in a residency program. And the other thing is everybody wants one. All the nurses are jealous. Every technologist in the hospital is jealous. All the attendings are starting to figure out, how can I get one? Actually, one of the attendings said that they wanted to come back to residency so they could get one. So I just want to turn it over to see if my residents had any further comments. I'll bring over the microphone.
Anybody have any questions for us?
Okay, so any questions?
How was your startup time in terms of learning the new app?
What we've found is that a lot of us, as far as the residents, have all had some experience with most of the apps on our phones. So we kind of, every day someone comes in with a new app, hey guys, look what I found. And it's like 5 minutes and we picked it up and all of us have it on our iPads and we're all messing with some scores that work. So as far as our usability, it's really cool.
All right, well, thanks so much, guys. I really appreciate it.
One more question?
We have two more presenters. Why don't you come back on the 23rd, because we'll answer a lot of that type of question at that next session with the individual apps and so on. I just want to make a disclaimer here. We did not pay Dr. Hasty to really endorse the library. We're thrilled to be able to help him. Dr. Joe Slingbaum from the College of Dental Medicine is next. He's going to talk about Apple TV and how he should use it in his instruction. I've got to tell you, to remind you that we are Ustreaming this. We'll also have it recorded with the link. I'll send out a link afterwards so that you can show it to your other faculty members that weren't able to come today. So.
There was a question when Dr. Mason started about how are we doing this? How can you walk around the room and show a presentation, show information? When we had our original iPad meetings, that was one of the questions we wants of the group. How can I go to a lecture? How can I sit in a classroom and have my students or residents or fellows or my colleagues looking at a screen and I'm not bound to the podium? And how many of you hate being bound to the podium? Because I know I do. I hate using a microphone, but I'll use it for today. What we did over in the dental school is we decided to try a test project. Got together with the network guys here, said what do we need to do, tried out a little test simulation to see if it was going to work. We ordered, like Dr. Mason said, $99, Apple TV. There are some quirks to it, there are some things that don't work well, there are some things that do work well. What I wanted to show today, which is simply how I can walk the whole room, show you how Keynote works, which we've already seen, audio, video, programs. I don't know if anyone's ever used this, seen this. It's basically comparable to the Netter anatomy drawings. What do we want? Circulatory, respiratory, skeletal? Circulatory. So from a teaching perspective now, wirelessly you can walk anywhere you want in a room, clicking on items, getting descriptions of them. Use this as a great teaching demo. This is an app called Visible Body. It's available on the App Store for approximately $25, $30. which we saw before at a previous meeting from probably one of the dental students, from a teaching or from an educational standpoint, if you're teaching your students, but also chair side. You want to learn a procedure, you want to show a patient what the procedure is going to be, very simply. Some of them have audio, some of them don't. In this particular case, very easily you can sit there, and as what's going on, you can then explain it to a patient so they understand what's going on. And it's a very easy teaching method, not only just for the patients, but for teaching students or residents, or even our colleagues if we're trying to give an educational demo. Videos. Anybody ever recorded a video or a movie or something that we wanted to show in class? Not outside of keynote. Just going to show this just so you can see as an example. This is what my daughter watches. She's 3. And the test we did, just so everybody understands, the Apple TV is there. This is not direct line of sight going from the iPad to the Apple TV. I'm going to walk around just so you can see while this still runs. Squeeze by you for 1 second. So anywhere in a lecture room that you want to walk, streaming a movie, streaming a keynote presentation, streaming any educational materials. So from anywhere, come on man, let's go. Anything with educational, teaching materials, lecture materials, you're not bound to that podium anymore.
What class do you use?
I tried it for potty training, it actually worked pretty well. One of the questions was, how are we going to use this in our clinics? How are we going to use this chair side? How are we going to be